Here's another question. Do you know? What is the number 2 cause of CKD?
High blood pressure causes about 1 in 4 or 25% of all cases of kidney disease. Source: https://www.kidneyfund.org.
Having high blood pressure means your heart is working too hard to pump your blood. It means your blood flows through your arteries, veins, and blood vessels with too much force or pressure. This can damage the blood vessels in your kidneys and cause CKD. Think of the kidneys as a colander or strainer. You can imagine water from the sink gently flowing through the colander. This is what it is like when the blood flows through the kidneys when a person has a healthy blood pressure. Now imagine a fire hose aimed at a colander. The strong pressure from the fire hose would cause damage to the colander over time. This can be compared to the damage high blood pressure causes when blood is flowing too forcefully through the kidneys over time. CKD can also cause high blood pressure. Remember that kidneys have a role in controlling blood pressure. CKD can cause high blood pressure when damaged kidneys make too much of a hormone that raises blood pressure. Whenever you get your blood pressure checked, keep in mind that a high reading could be connected to CKD if you already have CKD, which is causing your high blood pressure, or if your blood pressure is high for another reason, you may be at risk for getting CKD. It is important to check your blood pressure often. Blood pressure is measured using a cuff that tightens around the upper arm. Your doctor checks each time you visit, and you can also find cuffs at some pharmacies. You can also buy a monitor to use at home. A healthy blood pressure is considered 120 over 80 or less. High blood pressure is considered 140 over 90 or higher. Source: Centers for Disease Control and Prevention. 2021 Facts about hypertension. Retrieved from https://www.cdc.gov/bloodpressure/facts.htm.
The only way to know how well your kidneys are working is to get tested. Kidney tests are important because kidney disease often has no symptoms until your kidneys are badly damaged. This is especially important for people who have diabetes, high blood pressure, or a family member with CKD. Fortunately, there are simple, painless tests to check for kidney disease. The combined tests for kidney function are urine test and EGFR. The urine test uses a sample of urine to look for protein. When your kidneys are damaged, they may let protein leak through the filters and into your urine. This can be one of the earliest signs of kidney disease. Protein in the urine can be a sign that your kidneys are not working properly. It helps detect damage to your kidneys. Having protein in the urine for 2 months or more can mean the kidneys are not working as well as they should.
One urine test is the urine albumin to creatinine ratio, UCR. This test uses a microscope to look at urine in a lab. It shows how much albumin, a type of protein, and creatinine, a waste product in the blood, are in your urine. Your doctor compares the protein in urine to figure out your UCR. A normal UCR is less than 30. If your UCR is more than 30 milligrams per G, ask your doctor when you should be tested again. Source: National Kidney Foundation. 2020 ACR. Retrieved from https://www.kidney.org/kidney disease/Siemens_HCP_ACR.
The eGFR is a blood test that tells you how well your kidneys are working to filter waste from your blood. eGFR is short for estimated glomerular filtration rate. Your eGFR is a number based on your blood test for creatinine, which is a waste product in your blood that comes from your muscles. Healthy kidneys take creatinine out of your blood. Your doctor will figure out your eGFR using a blood test and other factors. Just as with the urine test, doctors look at eGFR over 3 months to decide how well your kidneys are working. If you have had only one GFR test, you may need to be tested again in a few months. No matter what your eGFR is, ask your doctor when you should be tested again and what other tests you should have.
In most cases, eGFR over 60 is considered a healthy result, 15 to 60 is considered CKD, and below 15 is kidney failure. In CKD stage 1 or 2, the eGFR may be normal. People living in stage 1 and 2 should live their lives as healthy as possible. Stage 3A is an eGFR of 45 to 59. Stage 3A CKD means the kidneys have mild to moderate damage and are not working as well as they should. By Stage 3A, you should be seeing a nephrologist or kidney doctor to discuss how to prevent the damage from getting worse. Stage 3B is an eGFR of 30 to 44. Stage 3B means the kidneys have moderate to severe damage and are not working as well as they should. Stage 4 CKD is an eGFR between 15 to 29. In Stage 4, the kidneys are severely damaged and are not working as well as they should. At this point, you should be seeing your kidney doctor regularly and following a treatment plan. Stage 5 is having an eGFR of less than 15 and means the kidneys are failing. Once in kidney failure, you will need to start dialysis or have a kidney transplant.
It is important to keep track of your numbers. Ask your doctor what tests you need, how often they should be, and what your results mean. In general, here's how often each test should be done and for who. Many people are unaware they have diabetes or prediabetes. It would be beneficial to get a yearly test of your A1C.